Hello, my name is Aisha Bosula. I'm a rising second-year medical student at the Drexel University College of Medicine. Over the summer of 2020, I was a Bridging the Gaps intern at a Philadelphia community high school program called One Bright Ray. I worked specifically at their Mansion Evening House campus. I worked with an academic preceptor, Dr. Leon McCree, who is also a faculty member at Drexel. Additionally, I worked with a community preceptor, Mr. Arkady Yelman, who is the principal of Mansioning Evening House campus. I sincerely thank both of these gentlemen for helping me complete my project. One Bright Ray is a community high school program in Philadelphia, and they work with students who are at least 1.5 years behind in credits needed to graduate with a high school diploma. There are 5 campuses with flexible schedules to accommodate students from all backgrounds. Most campuses in One Bright Ray target students between 16 to 21, but Mansion Evening House campus is exclusively for students over 21. They offer an accelerated and personalized program that allows students to further their education and careers. They use a unique learning model called project-based learning. This model involves answering driving questions and creating a final product. Also, students have the opportunity of completing a community-based internship over the summer. The first step of my project included collecting demographics and pass-fail rates of students at Mansion Evening House campus over the 2019 to 2020 school year. I analyzed data such as zip codes, gender, race, number of classes taken, and number of classes passed. I found an interesting relationship between gender and pass rates of the 137 students in the dataset. 36% of females did not pass at least one class, and 76% of males did not pass at least one class. Given this striking observation, I conducted a literature review to better understand how gender and academic achievement are related. I found that 3 potential factors, namely masculinity, race, and social behavioral skills, are supported to explain differences between male versus female academic achievement. Using previously established surveys to assess gender norms, race-related stress, and social behavioral skills, I created my own survey. I sent the survey to students at this campus to see how their beliefs and experiences align with the literature on influences between gender and academic achievement. I then interviewed a student to better understand the site, as well as the typical student experience at the site. Moreover, I created informative flyers on various health topics, specifically cardiovascular health, oral health, and smoking cessation. My survey was completed by 40 students and yielded the following results. Over 2/3 of the students felt that they had been treated unfairly at their workplace and had trouble getting bank loans because they are Black. 97% of the students believed that being male meant showing leadership within a community. 88% of the students believed that being male meant being self-sufficient. Therefore, male Black students are a demographic that seems to be impacted by both race and masculinity-related stress. This may explain the disproportionately high rates of Black males who had not passed at least one class at Mansion Evening House campus. I also attempted to promote cardiovascular and oral health at the site by creating flyers, such as the one shown on the left-hand side. These flyers contained information about community resources specific to Philadelphia and were posted on the school website. I am proud to have done this project, and I have learned so much. First, my perspective on community cardiovascular health, oral health, and smoking cessation have greatly changed. I learned that Philadelphia has the highest rates of adult smoking prevalence and premature cardiovascular disease across all major cities of the US. I found this very shocking because I expected larger cities to have higher rates of these issues. At the same time, I learned that Philadelphians have access to unique resources, such as smokefreephilly.org. This resource offers free counseling and medication to eligible residents to promote effective smoking cessation. With this resource, Philadelphians can combat both the physiologic and psychologic addiction related to smoking. I also found various health centers across Philadelphia that have a sliding fee payment model for patients. I found dental schools which helped connect patients with dentists, even if they have specific concerns such as needing a dentist for their children or needing a dentist for someone with special needs. Through my storytelling project, I learned the importance of a supportive and inclusive school environment to foster student academic achievement and interest. Hearing the student explain their experience as a student working remotely exposed some of the obstacles of students who have had to learn from home due to the COVID-19 pandemic. It is especially difficult for non-traditional students who have families and perhaps young children to focus at home. I had not been aware of these obstacles previously, as I am a traditional student who has not had these stressors. Finally, the storytelling project helped me connect with the site that I was trying to advocate for, because I felt more connected to that population and the site after speaking to one of their students. Overall, despite this project not being directly related to medicine, I believe it will leave a lasting impact on me as a physician in training. I learned about important issues such as racism-related stress and masculinity norms that may explain why vulnerable populations, such as Black males, have a unique confluence of stressors that negatively influence their academic achievement. Black males may face similar barriers when seeking healthcare. This is already evidenced in the well-documented phenomenon of medical mistrust. Therefore, I aspire to advocate for this population, which is burdened with greater stressors than other portions of the population, when I am a physician. Thank you.